And to my left, a guy, again, who needs no introduction, the Superintendent of the State Police, Colonel Pat Callahan. We've got Jared Maples, Director of the Department of Homeland Security and Preparedness, Deputy Counsel Paramila Garg here to help us answer your questions. We're going to do the daily numbers a little bit differently today and see what you think. If this is helpful, we think it might be. And if so, we'll carry it forward. Typically, we give the raw data of the overnight numbers, all of which, again, are reported on our data dashboard at covid19.nj.gov. And we'll continue to do this, by the way. But we'll now be plotting these numbers over sort of a rolling 3-week historical time frame to show you some trend lines. And we believe and hope that this will put some of the daily numbers into a broader and better context. So first up, here we go. Here are the raw numbers. Today we're reporting 3,026 new confirmed test results, and the statewide total, as you can see, is now 81,420. In our hospitals, as of 10 p.m. last evening, 7,718 residents were reported hospitalized. I got that right, Judy? Of whom 2,024 were listed in critical or intensive care, and 1,641 ventilators were in use. Additionally, 90 patients are at one of our field medical stations. And happily, for the 24-hour period ending at 10 p.m. last evening, 814 residents were discharged from our hospitals. So now, again, let's do something a little bit differently. Let's put these numbers into proper context. The first graph that we're showing you right now plots the rate of growth of new cases over the past 21 days, and as you can see, we are flattening the curve. This is a credit to each and every one of you who has taken to heart our aggressive social distancing measures and who continue to do your part. So thank you. Stay with this for a second. Again, these are dailies. The bars are the amounts per day of positive test results, and the curve is the one that fits through that set of bars over 3 weeks. Second chart we'll pull up. This one plots, since April 1st, the daily rates of new hospitalizations. And as you can see, we've been able to create some stability here as well. And there is a direct cause and effect relationship between the first graph and this graph. The slower the rate of new cases, the slower the rate of infections, the slower the rate of new hospitalizations, ICU beds required, ventilators required, and please God, fatalities that result. It is literally almost a mathematical derivation exercise. As personal as each one of these cases are, they have a name, they have a face, they are human beings in our blessed, beloved New Jersey community. And at the same time, this is also, we can derive from formulas and models mathematically some of what the reality is. Well, now let's go to the next one if we could. This chart plots the number of new hospitalizations against the number of daily discharges. As you can see, over the past 3 weeks, we have been able to move these lines closer together to the point we're now reporting more people leaving the hospital than entering. Please God, it stays that way. And I think you can see that. And finally, one more. Here are the daily numbers of patients in intensive and critical care over the past 21 days. Throughout the past week, as you can see, we've seen these numbers begin, and I say begin, Judy, to stabilize. So these graphs are what we need to see, and they are why we must keep up our aggressive social distancing. And again, so far so good, we just can't let up. This map, let's pull that up, which you've been seeing now for the past number of days. This further adds some proof as to why what we're doing is working. This is the time it is taking in each county for the cases to double across the state. And you could see, I think, the data, the numbers are a little bit small, but you see numbers ranging from 9 days to double all the way up right now in Bergen County at 19 days to double. And the higher that number is, Judy and Ed, the better it is. So let's keep that map as light as possible, and let's see those numbers continue to go up, up, and up. And again, that is thanks literally to everybody out there. It is your efforts that are leading to these results. We just have to stay at it, and not forever, but we have to stay at it for now. So sadly, with the heaviest hearts, This is data that we also have to report. We continue to lose residents to COVID-19. Today, we're reporting another 231 precious lives lost from among our New Jersey family, and we now have lost a total of 4,070 blessed souls. It's a number that takes your breath away. One of these who we have lost was Edison fire captain, let's see him, Richard Campbell. God bless him. He was a 28-year veteran firefighter. Firefighting and public service ran in his blood as he followed his father into the line of service, as did his brother, who sadly passed last year. Mayor Tom Lanke of Edison said that Captain Campbell's death, quote, leaves us short a hero. I don't think there could ever be better words by which to remember him. We send our deepest condolences to his wife, Kimberly, who I had the honor of speaking with this morning, and their 4 children who range in age from 27 down to 11, Caitlin, Kevin, Christopher, and Ariana. And I want you to keep Ariana in a special place in your heart as you pray for this family. May Richard rest in peace, and may his memory bring comfort to his family and to all who knew him. God bless him. Here's another member of our family, Herbert Bert Heaney of Maywood. He was 77 years old when he passed on Monday. For 36 years, he was a forensic scientist at New Jersey State Police's North Regional Laboratory in Little Falls, and Pat and team knew him well. He is being remembered by many for his dry sense of humor. He was a Vietnam veteran, and his wife, Mary Beth, reminded me today he had, as a result of that, all of the comorbidity, Judy, that you have and Ed have been warning us about, that made him, unfortunately, a direct target of this awful virus. And he continued his service to our nation in the U.S. Army Reserves, retiring after 29 years at the rank of Lieutenant Colonel. A proud member of the American Legion Post 42, Bert was dedicated to the community in Maywood. He served on the Maywood Board of Education, on the Maywood Recreation Commission, and as an assistant Boy Scout leader to Troop 12. What a servant. He is survived by his wife of 44 years, Mary Beth. I mentioned I spoke with her this morning, a giant in her own right. And he's also survived by their children, daughter Kathleen Heaney Schulman and his son, U.S. Navy Lieutenant Bert Heaney, who is deployed at the moment. Keep them in your prayers. And extended families, may God bless them all. And Mary Beth said one of the great memories of Bert's and honors of his life when he was on the Board of Education, he got to hand each his daughter and son their high school diplomas. God bless you, Bert. Union City lost one of its finest. There he is, look at that guy, Detective Alex Ruperto. Alex grew up in Union City, and even though he lived in Glen Ridge, he remained committed to his first hometown in a big way. After joining the Union City Police in 1999, so that's 21 years ago, Alex was one of the original members of the Emergency Services Unit, and at the time of his passing, was serving as a detective in the training division. He leaves behind 2 adult children, Juliana, with whom I had the honor of speaking this morning, and as you can imagine, she and her brother are incredibly busted up. By the way, Juliana also works for the Union City Police Department, and their son, or his son, Alex, who is in Philadelphia, Alex Jr. He is remembered by his colleagues as, and I quote, kind, patient, soft-spoken, and genuine. He was only 52 years old. God bless you, Alex, and we have your memory and your children in our deepest prayers. Each of these lives epitomize service. However, we know that every single person we have lost in this pandemic has been a cherished and invaluable member of their communities as well. They all gave back in ways both large and small. And for that, we thank them and we honor them. And we commit to them that we will do everything in our power to stop the spread of this disease and lose fewer and fewer, please God, fewer residents to it. Throughout this emergency, I have been in constant contact with mayors and elected officials of all shapes and sizes, but mayors up and down our state. And they have all reported to me that the overwhelming majority of their residents recognize the vital importance of doing the right thing and staying home even when it stopped being fun. And for that, we are deeply appreciative, thankful, and respectful. But as former Evesham mayor and a friend and Baltimore Ravens special teams coach, I might add, Randy Brown, reminded me that he's still hearing from too many people who continue to think, as we've discussed, that it's just the flu and that they don't have to change their habits one bit. And he suggested, I think it was a good suggestion for us to remind you why that's not the case. So here goes. Let me speak in particular directly to anyone who is sticking to this way of thinking. And I can't put it more bluntly. Judy and Ed can back me up. Based on everything we know at this time, that point of view is wrong. Surely we see flu outbreaks every year, and yes, New Jerseyans die of the flu every year. But the flu has not caused the devastation that we are seeing, especially among our most vulnerable populations. Look at the long-term care facilities. Look at our veterans' homes if you need any proof to this. The data we are seeing, the numbers and the science prove how this is a different enemy. Take a couple of numbers to heart if I can. In just 6 weeks, as we mentioned a minute ago, we have lost 4,070 blessed New Jerseyans to COVID-19. That's more than the CDC statistics show that we have lost over the past 3 flu seasons in their entirety combined. We know that the COVID-19 is more virulent than the flu, and one person with COVID-19 can infect many, many more without showing any symptoms. And once someone is exposed, it can take a long time, as much, Ed, as I believe 14 days to develop this illness. The hospitalization rate for COVID-19, as we've shown you, is far greater than what it is for the flu. The general hospitalization rate for the flu is about 0.1% of cases. Already look at the numbers we present here. For COVID-19, it's roughly 10%, I believe, Judy. You're therefore 100 more times likely to end up in the hospital, again, based on what we now know. And finally, and I guess this is probably the most obvious point, we have vaccines that can protect against the flu. We have proven anti-flu therapies. We're at least a year away, if not longer, from a vaccine for COVID-19. And currently, while there's some good, promising early-stage trials underway, there currently are no proven therapeutics. This is a pandemic the likes of which we haven't seen in a century. If you've been keeping your eyes and your mind closed to the facts and to science, please, I beg you to open them wide, before you, God forbid, become one of the numbers that I report here every day. And I know Judy and Ed would want me to remind you, will we learn more? The answer is yes. Could it potentially change some of what I've just said? Yes. Over time, the contrast between COVID-19 and coronavirus and the day in and year out flu may change. We clearly, God willing, will get a vaccine. Before that, God willing, we'll get therapeutics. Perhaps the denominator changes. There's some studies out now that claim that a lot more folks have been infected unwittingly, are asymptomatic, but have been touched by this already. There's a big debate right now, I think it's fair to say, about will warm weather impact this? And it's an open question. We actually, no expert will give you a definitive answer and say yes or no to that effect. But in the meantime, please trust us. Based on what we now know, the everyday run-of-the-mill flu, which itself could be a big challenge and virulent, is in a completely different category than what we're talking about here. So with that, now that I got that off my chest, a couple of other items I wanted to quickly brief you on. I had a concerning call from Chuck Schumer last night that there is not momentum right now in Congress to put significant amounts or any amount of money into direct state aid, and that would lead unequivocally to a national disaster. As I mentioned, that we are looking at what the Federal Reserve has presented to us in terms of a potential municipal bond program. I was very happy to see Speaker Coughlin yesterday say that he was looking forward to working toward a responsible plan. I think that's a good word to use. We need that now more than I thought we did 24 hours ago when you hear that Congress isn't finding, and I'm not going to get political here, but there's one part of Congress in particular that doesn't see the wisdom to put direct money into states. Let me just tell you what the alternative will be, particularly if we can't borrow money. We will have layoffs that will be historic in the history of our state, at the state level, at the county level, and at the local level. That's what's at stake. I don't know how many, but it is big, big numbers. So I plead, this is not either or. We need both direct financial assistance to states from a bill passed by Congress and signed by the President, and we will need bonding flexibility in either case. And I would just plead with folks on both sides of the aisle to please get to that reality sooner than later and make that happen. I've been back and forth, and I want to give him a shout out. He's been a very good partner. Secretary Robert Wilkie of the Veterans Affairs of the VA. He and his team have been back and forth with myself and our team and helping us work through the veterans' homes in particular. More on that over the coming days, but I want to give him a big shout out. As angry as we are, and I can speak on behalf of all of us, at the Bad Apple long-term care facilities operators, as angry and frustrated as we are, and I know you are, about the completely inconsistent and unacceptable level of communication, it must be said, like any community, there are good apples and good actors, and I want to make sure that folks realize that. And with time, we will find ways to shout them out. And regardless of who the operator is, there are heroic healthcare workers, not just in our hospitals, but in long-term care facilities, who are going in day after day after day to do the Lord's work for folks, in particular, our most vulnerable. And I want to make sure we say that. I mentioned the other day that life goes on away from this awful virus, and that includes births, deaths, youth, the aged. Again, life goes on. And I had back-to-back 2 striking calls yesterday. One with a very good friend, Sheriff Gilbert, otherwise known to everybody as Whip Wilson of Camden County, whose wife, Martha, in her own right, a giant, president of the Camden Board of Education, passed not due to corona, but due to a heart attack. I spoke to Whip. I spoke to his daughter. She was a giant. It was a tough, stark reminder that life and death go on, even away from this virus. So God bless Martha, and God bless and keep Whip and his daughter and their family in your hearts. And by the way, literally, the next call was to Olivia Eggers, who's 7 years old, who wrote me an incredible nice note. It reminded me that young kids are watching. I spoke to her and her mom, and by the way, Olivia's twin, Will, and her big sister, Mary. They're up in Mawa. And it's a good reminder that folks of all ages are paying attention. They're following this. And she wanted to reach out, and she sent me an incredible note to say that we're with you in this and hang in there. And it was an incredible conversation, and it was even starker coming on the back of having just gotten off the phone with Whip. So God bless the young, the old, the here, the now, the alpha, the omegas in our society who are swept up by this virus and those who are swept up just by life. I got no new announcements beyond that to make, so instead I want to remind everybody now just on testing, there are roughly 70 testing sites up and running across our state, both privately and publicly accessible. A complete list, as you can see, of the publicly accessible sites can be found at covid19.nj.gov/testing. Additionally, Rite Aid is beginning an appointment-only testing program at 3 of its New Jersey locations. The store in Waldwick in Bergen County, I believe, opened its program today, and Barrington in Camden County is set to open on Monday, and Toms River in Ocean County to follow on Wednesday. These sites will be added to our online list, and you could go to riteaid.com for more information and to make an appointment. So we thank our friends at Rite Aid. And your primary care practitioner could direct you to one of the many other sites should you meet the requirements for COVID-19 testing. We continue to work aggressively to ramp up testing capabilities, as we know having a strong testing regime in place is critical for us moving forward as we begin to plan at some point, whenever that is, to reopen our state. Again, remember, the order of events here is crack the back of this virus, bring the cases, the new cases down, and please God, illnesses and fatalities to a much lower number. And then make sure that we've got in place the proper healthcare infrastructure, rapid, scaled testing, contact tracing, means to quarantine and isolate. Those elements must be in place. And with that, we can have the confidence, you can have the confidence that we can begin to open up again. Also, we continue to ask for volunteers with medical experience to join our army against COVID-19. Specifically, we need respiratory therapists, I believe, Judy, still, physicians, nurses, and paramedics. If you have experience in these positions, please visit covid19.nj.gov/volunteer, as you can see, to sign up. And in doing so, you'll be adding your name to the more than 22,000 healthcare workers who have volunteered with us. And for those of you who simply want to start giving back to your community, not necessarily because you're a healthcare worker, but just generally you want to give back, please visit covid19.nj.gov/help, and we will help match you with opportunities near you, whether it be delivering meals to older residents or those with special needs, or helping to stock a local food pantry. These and others are critical needs. Now, before I turn things over to Judy, I want to mention a young man in Vineland, Cumberland County, who we should all be celebrating today. This is Dominic Mercado. It's his 12th birthday. Happy birthday, pal. He's a 6th grader at Sergeant Pilla Middle School. He had an unusual request for birthday presents. He asked for his neighbors and community to bring him boxes of pasta and cans and jars of tomato sauce that he will donate to the Vineland Soup Kitchen. And former Assemblyman, I want to give a shout out to Matt Milan. This is the guy who sent this my way, and Matt is the president of the Board of Trustees of the Soup Kitchen. I should note that since the emergency started, the Vineland Soup Kitchen has gone from serving approximately 120 meals today to almost double that, if not more. Dominic set up his table outside his house, and yesterday alone, more than 100 people drove past and dropped off, with social distancing, Judy, some birthday presents for him. He's back at it again today, so if you're in South Jersey, go wish Dominic a happy birthday from a distance, please. Make sure you've got your face covered. He's on East Grant Avenue by the intersection with South Main Road. Dominic's dad, another friend of mine, Carlos Mercado, is a Vineland firefighter. Obviously, the apple of service does not fall far from the tree. Dominic, we wish you the very happiest of birthdays, and we thank you. And if you know someone like Dominic making a difference, tell us their story on social media by using the hashtag #NJThanksYou. It's these stories of hope and optimism and of service and community that are drawing us together, even as we have to stay apart. To everyone doing the right thing to help us flatten and eventually break the back of this curve, thank you. Your efforts are making a real difference. It's how we're going to defeat COVID-19 and come out strong and ready to get our state back on its feet, back to where it was, and back to where we know it can be again. With that, please help me welcome the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor, and good afternoon. Each day I read race and ethnicity statistics that demonstrate the disproportionate impact that the coronavirus is having on communities of color. So I'd like to put that in a little more context this afternoon. Studies have shown for years that the social conditions in which people are born, learn, live, work, and age affect their health. In other words, your zip code sometimes matters more than your genetic code. These social determinants of health, economic stability, education, healthcare, social supports, and environmental issues like air pollution in cities that contribute to high asthma rates, place an additional layer of health concern on top of this pandemic for New Jersey's communities of color. Last week, First Lady Tammy Murphy, Lieutenant Governor Sheila Oliver, Human Services Commissioner Carol Johnson, and I discussed these issues Tuesday night with Senator Ron Rice, Assemblywoman Sumter, and the New Jersey Medical Association. The New Jersey Medical Association is a chapter of the National Medical Association, the largest and oldest national organization representing African American physicians and their patients in the United States. We were joined by their president, Dr. Damali Campbell, and the following physicians: Dr. Omar Bey, Dr. Montre Thomas, Dr. Jacqueline Cook, Dr. James Lee Jr., Dr. Cynthia Page, Dr. Karma Warren, Dr. Patricia Whitney Williams, Dr. Natalie Roach, Dr. Pamela Brugg, Dr. Kathy Duncan, and Dr. Joanna Hutchinson Colas. These legislators and physician leaders raised important issues, and we share their concerns and will be working on their suggestions. The members of the association are basically trying to rely on telehealth in their urban environments and shared with us how difficult that is. They support more testing in community clinics. They called out the FQHCs as areas that we should be focusing. And they talked about the importance of staying at home and social distancing, but that in some domiciles, that's very difficult to do. So we will continue to work with Senator Rice and the New Jersey Medical Association to do everything in our power to reduce the disproportionate impact that the coronavirus is having on communities of color. We must ensure that all of our communities stay safe and healthy during these difficult times. As the governor shared for today's report, our hospitals reported 7,718 hospitalizations last evening. This is a 3% decrease on the daily growth rate for the past 2 days. There are 2,024 patients in critical care. 1,641 of those patients are on ventilators. A total of 814 COVID-positive patients were discharged yesterday, bringing our total discharges to 9,692. Today, we are reporting 3,026 new cases for a total of 81,420 cases in our state. And sadly, 231 new deaths have been reported to the department. There are 125 new deaths reported and associated with long-term care facilities. We share our condolences with the families who have lost someone they love. According to data from this morning, of the 7 laboratories sending us COVID-19 results, 147,850 tests were performed, 66,734 returned positive. Our positivity rate is 45.14%. Our state psychiatric hospitals are reporting 119 patients testing positive, and as I reported yesterday, they sadly report 7 of their population have passed away. The New Jersey Veterans Home census right now is 787. 151 have tested positive, and they have reported 59 deaths. There are no cases at the Vineland location. The breakdown on race and ethnicity is as follows: 50.9% white non-Hispanic, 22% black non-Hispanic, 16.7% Hispanic, 5.4% Asian, and 4.8% other. The underlying conditions of our fatalities remain the same. Thank you again for staying home and maintaining social distancing. It surely is making a difference.